Ladies and gentlemen, thank you so much for coming to the Managing Osteoarthritis with Hydrogen webinar. It's a conversational webinar to understand and improve the symptoms of osteoarthritis.
I'm Azizan, a physiotherapist from Faculty of Health Sciences, UiTM Puncak Alam campus. So today I will share a little bit about what is osteoarthritis and focusing on the physiotherapy roles.
What is knee osteoarthritis?
Well, osteoarthritis of the knee is very common, right? Approximately about 46% of people will develop it during their lifetime. Okay, study shows that knee osteoarthritis, or known as OA, is degenerative arthritis that caused by overstress, affecting the bone cartilage of the knee that gradually wears away, causing inflammation, pain, and also functional limitation. Or else, we can also simply say that OA happens when the cartilage in our knee joint breaks down, okay, which will cause the bone to rub together. So this friction makes your knees become hurt, stiffness, and sometimes swells. As you can see in this picture, there are 4 stages of knee OA, ranging from 1 to 4, right? Okay, in stage 1, is a minimum disruptions that already has about 10% of cartilage loss. Okay, in this stage, patient with the knee OA will develop very mild wear and tear and development of the bone spur, right, at the end of the knee joint. However, at this stage, it is unlikely that you might feel pain or discomfort, all right? How about the stage 2, mild stage? According to a diagnostic image or X-ray of the knee joint, will show a more bone spur growth, which we call it as osteophyte, and there is a joint space narrowing and cartilage begins to breaking down. In this stage, the joint space between the bones are considerably reduced, that causing the cartilage to wear off, so leaving the joint stiff. All right, the breakdown of the cartilage leads to a chronic inflammatory response, with decreasing the synovial fluid around the bones that will cause friction with a greater and greater pain and discomfort when you're walking or you're moving the joint. So there are 4 major changes that we can classify for those with knee OA. They're having a pain that aggravated with the weight-bearing task, right? Narrowing of the joint space, decrease in production of the joint lubricant, and also formation of the bony outgrowth. So all these will result in the knee stiffness, swollen, or you feel puffy, and other patients sometimes complain of cracking or grinding noise when they move. Right? To summarize here, they have 2 main type of knee OA, which we call primary and also secondary. The primary ones, most common, generally affect the finger, thumb, our spine, our hips, knee, and also our big toes. While the secondary OA occurs with the pre-existing joint abnormality. They include injury or trauma, or such as repetitive sports related, or even inflammatory arthritis such as rheumatoid, gout, and also on.
So what causes knee osteoarthritis?
Osteoarthritis of the knee happens when your knee joint cartilage wears out or is damaged, right? So articular cartilage is like a very tough or rubbery tissue on the end of your bones that lets you to bend and move, right? And there is also a meniscal cartilage that absorb the shock from pressure on your knee. Okay, can you imagine something like this, right? Your cartilage is like your car shock absorber that protect your car from bumps and jolts, all right? Drive on lots of rough roads, your shock wear out very fast. And how about drive on the easy street? Your shocks will last longer. So you can wear out your damage of your knee joint cartilage if, number 1, the age factor. A study shows that about 80% of older adults aged 55 years and older have a tendency or high risk to have a knee OA, okay, according to their X-ray. And the second factor, due to weight, being overweight. If your body mass index is more than 30 or more, you have high risk, about 7 times more likely to develop knee OA as compared to those with someone with a low BMI, right? Previous study shows that this overweight have overloading the weight-bearing mechanism of the body. so that the metabolic and also the pro-inflammatory effect of the obesity can be contribute to the confounding factor for osteoarthritis, right? The next one due to heredity. Okay, heredity can play a major role in osteoarthritis as individual born with the other diseases or genetic trait may be more likely to develop osteoarthritis. For example, the Ehlers-Danlos syndrome, which is characterized by what we call joint laxity or hypermobility, that also contribute to the osteoarthritis. All right. The next factor due to gender. Okay. Gender difference. Okay. Study shows that women more likely to develop osteoarthritis of the knee compared to men. Okay. Why? All right. This happened due to decrease the hormone estrogen as experienced by the postmenopausal woman. They will increase the risk of OA. All right. As we know that estrogen is a protective of the bone health, right? Specifically during to reduce the oxidative stress to the cartilage. So what happened? Less estrogen, meaning you high risk to develop the knee OA. Next factor due to repetitive stress of injury. You injure your knee or you have the old knee injury, you will double the risk to develop the knee OA in the future. Also for the athlete, okay, they frequently put the stress on the knee due to the playing of the sports, or they have also a manual job that require the bending position repetitively. So all these factors, 1, 2, 3, 4, 5, 6 factors may contribute to the what we call it predisposing factor or causes to the knee OA.
So what are the symptoms of knee osteoarthritis? What can you expect from experiencing knee osteoarthritis?
Patients typically present with the symptoms that are insidious, chronic, and also gradually worsening, right? Clinical features should be included with the knee pain, swelling, stiffness in the joint that will worsening with the activity, and but will be relieved by the rest, okay? And then this pain tend to worsen throughout the day, whereas stiffness will tend to improve. The prolonged osteoarthritis will result in knee deformity, right? They limit the decrease in the mobility, and sometimes patients feel for crepitus sounds, like cracking sounds, throughout the range of motions. So the movement of the joint is generally reduced and very painful. These are the typical symptoms that we can say for those having with a knee OA.
So how is knee osteoarthritis treated?
So actually the management of knee OA involve ranging from conservative to medical or even to surgical. But for today, we will learn and understand the conservative treatment, or we call it non-surgical treatment, that primarily focus on physiotherapy roles. Okay, next slide. So in physiotherapy, the common treatment that we prescribe for the patients for OA may include, next slide please. Yeah, pain management, or we provide the modalities that include the heat and cold treatment, right? And exercising that focus on the component of stretching and strengthening, which could also be performed at the land or the water-based exercise. And then we also include the balance training, joint protections, or also we call it supportive device, such as braces, orthotic cane or walker, that emphasize on the patient education also, and also the joint mobilization. So let's take a look what component of exercise that we as physiotherapists generally prescribe for those with the knee OA. So we include the core protocol that comprise of 4 components. Here we have aerobic, strengthening, stretching, and also neuromuscular. Okay, next we go to our core component. The first one is aerobic exercise. Okay, cycling on treadmill or walking is performed up to 10 minutes with a patient achieving about the level of 13 on the box scale, all right, within a 2 minute of activity. This exercise should be discontinued if patient report increase in pain up to more than 2 points on the numeric pain rating scale. Okay, so kind of cycling, treadmill is good for those with knee OA. But okay, next slide, we focus on the second component. The core protocol component is strengthening. Here, each strengthening is done for 3 sets for 10 with a 3-second hold or until fatigue. The strengthening component can be divided into two. We have an open change exercise and closed change exercise. Okay. Also, for those patients we complain increase in pain up to more than 2-point scale on numeric pain rating scale, you should stop the exercise immediately. Okay, next we go to the next slide. What is open chain? Well, the open change, here this is open change progressions. We start with the basic one is the isometric quadricep sets, or we call it isometric quad set. Just like pressing the back of the knee, as you can see in the picture, pressing the back of the knee down through the bed, or even you roll a towel below, and holding the leg in the same position for about 10 seconds, and then repeat for 10 times for one set. You need to perform at least 3 sets, okay? And then progress with the terminal knee extension and terminal knee extension with the calf weight. You can put a sandbag or calf weight. Start with the low, what we call low weight, 1 to 2 kilo perhaps. The same exercise also, hold the leg in the same position about 10 seconds and then repeat for 10 times. The next slide is the close change progression. Meaning close, you have a most, what we call, most safe, and is better as compared to open chain exercise for those with knee OA. Okay, the early phase you can start with the close and then progression with the open. For level 1, terminal knee extension in standing using the resistive band, or we call it TheraBand. Okay, you hold for 10 seconds and repeat for 10 times. Okay, facing the wall, and then you can progress to the level 2. You need to perform the weight reduction partial squat, all right, against against the wall, and continue for level 3, step up with the quad, right? All this for strengthening of the knee and strength. You need to perform this exercise, right? 10 repetition. For each repetition, you must hold about 10 seconds, right? So this 10 repetition equivalent to 1 set. You need to perform at least 3 sets. Okay, clear? Okay, good. Next slide, we move to the strengthening of the hip extensor. Here is major component. The hip extensor may comprise of, we must focus on our major muscle group that comprise of gluteus maximus. We have a posterior head of the adductor magnus, and also the hamstring. All the hip extensor helps you to, what we call, to reduce the pain, as you have a strong muscle to pull out your knee bones, right? So start with the supine glute sets. How to perform this one? As you can see in this picture, just lie down on your back with the knee bent, or you may put the small ball in between your thigh and hold it, right? Gently squeeze your glutes and hold the ball. Hold about 5 to 15 seconds, and then relax back to starting position and repeat for 10 times. Right, so you can progress to the level 2 and level 3 with the supine bridging and supine unilateral bridging. Unilateral means only one leg will be lift up, right? The bridging is same component as the supine glute. However, you need to squeeze your glutes, okay, your back muscle, your gluteus maximus, and gently lift your pelvis off the ground upwards. Okay, you need to hold about 5 to 15 seconds and then relax back to the starting positions. And also must be, remember, be careful not to arch your back while you're doing this. However, you need to focus on your moving your pelvis with your gluteus and your hip, right? Also repeat for 10 times. Okay, the last component that very important for strengthening of the knee flexor. Next slide. Knee flexor that comprise of a set of hamstring, gracilis, sartorius, gastrocnemius, plantaris, and popliteus muscle. All these are the major muscle for knee flexor. So there's a option. You need to perform level 1 with the prone hamstring curl. Start with the lying down and do the curl for the knee, right? And progress with the standing knee flexion, or we call it standing hip extension, is the same. against the resistive band or weight. Okay, this exercise can repeat also 10 times for one set and do for 3 sets. Make sure each set you must rest in between 2 to 3 minutes to avoid the muscle become fatigue. All right. Next, we go to the next slide for the third core protocol. This is stretching exercise. So each stretching component need to be done for 2 minutes total, right? For each stretch that comprise about 20 to 60 seconds of hold. Okay, when you perform the stretching, you must hold for at least 20 seconds. So repeat until a total of 2 minutes. So we can have a next slide. We have here calf muscle stretch and also eccentric. Eccentric meaning lengthening of the calf stretch. So bend. For the first picture, you can see the calf stretch. What you need to perform is you just need to bend your, for example, your right leg forward and extend your left leg straight behind you. Okay, the toes of the both feet should point towards the wall, right? And lean forward the wall and push your left heel into the floor, right? Hold about, as I mentioned before, 20, at least 20 to 60 seconds before you need to repeat to the opposite leg, okay? And then you can progress to the you can stand at the stool or even at the foam or at the stairs. Okay, you can perform this eccentric calf stretch. Next, we move to the next slide. The last component is the neuromuscular control, right? Each patient needs to perform at least 3 of the following exercise I will show after this for at least duration of 2 minutes. Okay, you can choose either one. And the goal is you need to perform at least 6 minutes of neuromuscular exercise. If the patient cannot perform any 3 different activities, you can repeat or change with the other kind of exercise. Okay, next slide. What exercise? The balance component. Here, as you can see in the picture, we start with the easiest one, double leg form balance, all right? Then we need to progress to the double leg wobble board. Okay, this is the wobble board, the second picture. The last one, progress to the single leg stance on foam, all right? For those elderly, for sure, elderly cannot perform standing on this foam, you can start just on the floor. And then you can progress by challenging yourself, standing on the foam balance, all right? Make sure you start with your feet far apart as the balance device allow, and be careful for elderly. You need to someone to stand by, and those who have a high risk of fall, make sure you have something to grab. You put a chair in front of you or standing against the wall, all right? The next component for neuromuscular, you can perform also the side stepping exercise. As you can see in the first picture in level 1, right? You stand with your feet hip width apart and your weight equally distributed on the both legs, right? Hold the position as long as you can, maintain a good form, meaning that tak adalah, no sway of your body, and then perhaps up to 30 seconds, okay? And return to the starting position and repeat to the other side. For example, you start with the right leg and then you continue with the left leg, okay? And then you can progress to the level 2 with the side stepping with obstacle. You can put a cup in between your stride step to challenge yourself, okay? The last level 3 is the karaoke or breathing. It's adding the karaoke exercise to your activities, to your neuromuscular component is very good because this will stimulate and to strengthen your fast twitch muscle fiber. As we know that we have a fast twitch and slow twitch muscle fiber, the fast twitch muscle fiber will be activated and strengthened in the lower limb and improve the range of motion in the natural form of walking. Okay, so what you need to do is that just stand sideways to the direction of your travel, okay? And you can see in the picture number 3, just cross your right foot over your left and then step your left foot to uncross your leg. Step again with your left foot to return to the starting position. Okay, you can go to the YouTube after this. Just search for karaoke dancing, karaoke exercise. So then perform this according to your own rhythm, and this will challenge your dynamic balance. All right. And the last one is about stairs climbing. Okay, the next slide. Stairs climbing is very good to enhance your neuromuscular. The patients can ascending or descending 3 stairs with the alternate steps pattern to increase their strength and functional activity. All right. For those that have a poor muscle strength with the high risk of fall, they can use your upper body to help you to grab something to just to improve your balance. All right. Strengthening the muscle around the knee will decrease the stress on the joint itself. Sometimes patient complain, I have a difficulty and also pain during the climbing or ascending down the stairs. How I want to perform this exercise? Well, actually, you need to perform this exercise also as the muscles that include the quadricep at the front of your thigh and hamstring at the back of your thigh. This large muscle group, this both large muscle group will help in strengthening of your lower limb muscle. Okay, and you use your own body weight just to make your climbing quite challenging. All right, so you can perform the exercise during early morning or at the evening, about 10 to 15 minutes. All right. So last slide, we go to our conclusions. All right. According to the American College of Sports Medicine, or ACSM, and the CDC, the Center for Disease Control and Prevention, that recommend that for those each person or elderly should perform at least 150 minutes with the moderate intensity of aerobic training, aerobic component, 150 minutes, and must be combined with at least 2 types of strengthening component that focus on your major muscle groups, such as I mentioned before, the quadricep, the hamstring, for the lower limb part. Yes, you need to perform the strengthening component at least 2 for a week, right? And those having the knee OA can perform either 5 times a week with a 30 minutes, 30 minute, 30 minute total of 150 minutes, okay, 5 times a week, moderate intensity, or you can perform at least 3 times a week with a duration about 50 minutes for each, 50 minutes, 50 minutes, and 50 minutes. Total must be 150 minutes. Okay, clear. This is what we do for physiotherapy to help in managing the knee OA, to reduce the pain, to improve the strength, and so that all the functional activity can be independently performed and improve overall the health quality of life.
What are free radicals?
Yeah, thank you for the questions. Yeah, what are free radicals? Free radicals are unstable molecules. Okay, based on these figures here, we all know that atom, right? Atom is the smallest element that occur in the world, in the earth. So when 2 atoms combine together, we call them as a molecule. For example, here is the oxygen. So you see this is an oxygen molecule. We call O2 molecules, right? So O2 molecules, the stable molecule should have 1, 2, 3, 4, 5, 6, 7, 8. 8 electrons on the outer surface, the outer orbit. But on the right-hand side, you can see that there is 1 electron missing from the orbit. So when 1 electron missing, this can no longer call a stable charge, and they become very reactive. They will go and interact with other molecules because they are reactive, they are not stable. So these kind of molecules, we call them as free radicals. And the example here is the superoxide anion. It looks like oxygen, right? It still have O2 combined together. However, it has 1 missing electron. So this kind of molecules, they are unstable. They'll go and attack other molecules in our body. Okay, this is the basic definition of free radicals. Sean, do you mind to go to the next slide? Yeah, so here are the examples, right? These are called ROS. ROS stands for reactive species, reactive oxygen species, ROS. ROS is a subset of free radicals that contain oxygens. So these are few examples here. The first one is oxygens, O2. O2 is very stable. Okay, you can see there is no red dots there. But the next one is superoxide anion. You can see there is 1 electron missing. Okay, so this molecule is unstable and it has one negative charge and they are reactive. And the third one also, it has 2 electrons missing. So this one is known as peroxide. They all come from the oxygen family, but they are not the stable oxygen. So these are called free radicals, or ROS, reactive oxygen species. Yeah, Sean, go to next slide.
So where do free radicals come from?
Yeah, where the free radicals come from? It can be multiple factors. It could be external and internal. External such as UV ray. Okay, if you're exposed to sunlight without any protections, it can actually induce more free radicals in our body. And air pollution, or some chemical poisons, radiation, medication and drugs, even unhealthy diet, like having too much of processed food, too many chemicals in our bodies, that will actually generate more free radicals. Smoking and drinking alcohol, so that is definite, will induce a lot of free radicals in our body. Radiation from gadgets, like nowadays we have mobile phones, we look at the computers a lot. So there are some radiations emitted from those devices that can also increase the free radicals levels in our body. And even stress, if we don't have enough sleep, we don't have enough rest, and the stress level increase, that will also increase the free radicals in our body. And intrinsically, right, if we don't do anything, if we are living in a very healthy environment, but intrinsically, internally in our body, naturally, our body also already producing free radicals. Sean, can you go to the next slide?
Okay. Yes, here we go.
Yeah, so this is what's so-called the intrinsic factors. Mitochondria is like a factory. It's a cell in our body, right? It is like a factory to process food in our body. So that is how we produce energy from our food. However, along this process, right, when the mitochondria processing food, it will generate some we so-called byproducts. It's just like a factory. During the process, during the manufacturing, you will produce some byproducts, some waste. So the waste is so-called superoxide anion. And body, naturally, we can handle it. Because this is a natural process since we were born. Our bodies produce about 2 to 5% of free radicals every day. But we can cope with the 2 to 5%. We have our enzyme, we have vitamin, we have antioxidant in our body that can get rid of these free radicals. However, if due to the factors just now, right, all the external factors just now, if we don't have enough sleep, stress level increase, we're exposed to radiation, exposed to chemicals and so on, the free radicals level increase in our body and our body cannot cope. If it's more than 2 to 5%, then our body cannot cope. And then we will start to see different sorts of symptoms or diseases. Yeah, I hope I answered your question.
Okay, now let's go on to the next question, which is how do free radicals play into osteoarthritis?
Okay, great. So this question is very much related to today's topic. We are talking about osteoarthritis. While ROS or free radicals, they play a very important roles in osteoarthritis. It has been proven in studies. The osteoarthritis progressions, right, the crucial risk factors include the oxidative stress and inflammation. And oxidative stress is caused by the excessive free radicals. And these free radicals, they can actually damage the proteins, lipids, the nucleic acid, the DNA, or the matrix component of our joints. And also, it will also send out the signals, okay, to our different molecules to amplify the inflammatory response. Meaning that it will tell our joints, right, to respond, okay, to the free radicals, and it will cause inflammation in the joint. So that is one of the risk factors of osteoarthritis. And eventually it will cause, the degenerations of cartilage, and slowly it will form the osteopenia and the osteoarthritis.
Okay, we'll move to the next question. So what can you do about free radicals to prevent osteoarthritis?
Yeah, so what can we do? So apart from all the exercise that Dr. Noor has teach us just now. One way to prevent, we're talking about prevent, before the osteoarthritis happens, one way to prevent it, okay, it is to reduce the free radicals in our body, right? We know free radicals is the root cause, right, for the osteoarthritis. So we have to come up with ways to reduce the free radicals in our bodies. And one way to do it is through the antioxidants compound to neutralize the free radicals. Yeah, I think I know your next question, John, will be what is antioxidants?
So
right?
what are antioxidants?
Yeah, so antioxidants, they are actually substances that can prevent or slow down the damage caused by the free radicals. So how they do that is, antioxidants is a very complex molecules. They have multiple electrons on their electrons orbits. As you can see from the pictures here, there are multiple electrons, okay, on the outer orbits. And they can actually donate the electrons. They don't need so many, they can donate some electrons to the free radicals. Free radicals, they are lacking of electrons, right? So when the antioxidants donate the electrons to the free radicals, it can make the free radicals to become stable, so that they then don't go and harm our other tissues.
So where can we find these antioxidants?
Yeah, antioxidants can be natural or artificial. Natural means through our daily diet. The most important one is shown here, the greenery vegetables. Include all these broccoli, Brussels sprouts, and usually your children don't like it. So these are the greenery vegetables or fruits that full of vitamin and minerals. So generally those are good antioxidants, and naturally you can find from our daily diet. But let's say if you don't get enough vitamins or antioxidants from daily life, then we need to rely on supplements. So there are all sorts of different supplements in the market nowadays. There are some examples here. If you see the names, the first one is a glutathione, L-glutathione. Glutathione is one type of enzyme, okay, which can get rid of free radicals. Okay, they are one type of antioxidants. Catalax also is a very good enzyme to get rid of free radicals. And the last one you can see is a superoxidant. So in the market, there are many like complex supplements that combine different antioxidants together. So generally they are from vitamin and minerals. Yep.
Okay, so how does hydrogen help reduce free radicals and prevent or manage osteoarthritis?
Yeah, hydrogen. Okay, let me introduce what is hydrogen first. We are talking about molecular hydrogen here. So the symbol is H2. H2 is two hydrogen atoms combined together. They are stable. They are stable molecule. They are non-toxic, and in fact, they are the smallest. They are the lightest molecules in Earth. Okay, if you still remember our periodical tables that we studied in secondary school, the first atom there is hydrogen. Hydrogen is the smallest element in the Earth. So when two hydrogen combine together, that is known as molecular hydrogen, and the symbol is H2. So how H2 can get rid of free radicals? H2, in fact, right, they are natural. They are in a gas form, and they have a very good functions to become a very strong antioxidant. Okay, why we say that? Because it has the function, it has the capabilities to get rid of harmful free radicals. So let me just go back to my explanation just now. I said our body producing free radicals, right? Not all the free radicals are harmful. There are some good free radicals as well. And we need that some good free radicals, such as the example here, if you can see from the slides, the hydrogen peroxide. Okay, hydrogen peroxide is a free radical, but they are doing good function. They can help to, when our body has bacterial attack, so it can help to kill the bacteria. And superoxide anion also is a good free radicals. They will help to metabolize. It will help to regulate our metabolism. Okay, so we need these good free radicals as well. But there are some very bad free radicals, which is the first one, the hydroxyl radicals. Sometimes we call OH. Okay, these are the very harmful and very reactive free radicals that can harm our body. So hydrogen, right, it has very unique features here. We call it as selective. they are very selective. So hydrogens, they only target the harmful free radicals, which is the hydroxyl radicals here. Okay, so to reduce the levels of bad free radicals in our body. But at the same time, right, it also synergistic. Synergistic means it helps to work together with our body enzyme, the catalase, superoxide dismutase, and the superoxide dismutase here. These are the natural antioxidant in our body. They are in the enzyme form. So hydrogen molecule can help to enhance the enzymes in our body to promote, okay, the activity of the good free radicals. So it's not only have one function, it get rid of the bad free radicals, but at the same time, it also help to enhance the good free radicals, right? And the third benefit is the size is very small. If you look at the picture on the right side, molecular hydrogen, the size is about 0.3 nanometers, which is very, very small. It's the smallest molecule in the earth. So why small is good? Okay, so small size means it can easily pass through, our cell membrane, and most important is the blood-brain barrier. And a lot of vitamins or antioxidants in the market, they are in the large size because they are complex. They are complex molecules. They are in the large size. And due to the size, right, they cannot easily pass through the blood-brain barrier. Okay, blood-brain barrier is a very important barrier that prevents, okay, the basic DNA of our cell. Okay, so if the medicine, right, or the supplements, okay, they cannot pass through this blood-brain barrier, then they cannot treat the disease. Okay, in another way, the hydrogen molecule, because they are very small, they are 0.3 nanometer, they can easily pass through the blood-brain barrier, and they can easily treat the diseases. So these are the three very important functions of molecular hydrogen.
Okay, we have some of these research articles that you would like to share about.
Yeah, I've done some literature survey here. So I found multiple papers, but I only picked these three to show to the audience today. The first article it was published in 2021, just last year, in the Journal of Inflammation Research, which is related to OA. The title here is hydrogen molecule, right? Alleviates OA by inhibited the apoptosis and inflammation via the JNT signaling pathway. So this paper go deeper, okay, into the mechanism. We say hydrogen is good to get rid of free radicals, but how? So this paper study how. So they found that hydrogen molecules, like, they can interact with this JNK. JNK is a signaling molecule. It's naturally in our body. JNK is a pathway, generally known as death signaling pathway. It controls the cell response to the harmful extracellular stimulus, okay, such as the inflammatory cytokines. So when our body attacked by free radicals, the JNK pathway will be activated, and then it will generate, okay, it will call up the cytokines. Cytokines is the cells that will cause inflammation, okay, in the body. So it will cause inflammation in our joints. And if the DNA damage could not be repaired immediately, the cell must be programmed to death. This is so-called apoptosis. It's a programmed death of the cell to avoid bad mutation or damage to happen. And JNK signaling pathway is such a death pathway that controls the cell death. So when our body have free radicals attacking, right? So the JNK pathway will be activated, and then it will it will produce a lot of inflammatory cytokines, and it will cause our joint to inflame. And over time, that is how osteoarthritis is formed. Okay, so they found that molecular hydrogens, they have functions, okay, to inhibit, to block this JNK pathway, so that our body don't overreact. Okay, so hydrogen not only get rid of the bad free radicals, they also tell the body, see, now I can do my job, I can get rid of these free radicals, please don't respond excessively. Okay, so it will reduce the inflammations in the joint. Okay, if you go to the next slide, Sean.
Okay, we have the next slide.
Yeah, just to show like what the authors have done, what the researchers have done. So they have three groups of rats, okay, 15 pieces each. And the sham group, the first group is called sham. Sham means a control group. They are completely healthy. Okay, they don't have osteoarthritis. Group number 2 is the osteoarthritis group. How they make the rats to become osteoarthritis? Okay, very badly. They're going to damage the medium meniscus of the rat. DMM is the damaged medium meniscus. They cut. Okay, they open the joint. They cut the medium meniscus of the rat to induce osteoarthritis. And the third group also is an osteoarthritis group, but they treat them with 75% of hydrogen gas. Okay, second group not undergo any treatments. And the third group, they undergo the treatment by hydrogen gas. And on the right side, you can see the pictures. The first picture is the X-ray image. So X-ray image, you see the arrow there, the white arrow shows the narrowing joint, okay, between the two bones. And the dark arrows there, okay, showing the cartilage surface, which has calcification. And on the right side, the DMA group with hydrogen treatment, okay, you can see the calcification is lesser, and also the narrowing space is reduced. Okay, they have more space in between the joint. Okay, if you look closer, the lower pictures there, okay, those are the microscope image. So you can see the synovitis score, okay, the last row, the bottom row there. The first group is the control group. Okay, you can see the cartilage is very nice, very complete. So there is no synovitis at all. But the second group, the damaged DMA group, okay, the cartilage already lost. And the third group with hydrogen therapy, they can actually prevent, the loss of this cartilage surface. So this is how hydrogen molecules can help in this research, and they have found that how they help, they actually inhibit the JNK pathway. Yeah, so this is what this paper about. I have a second research here. Okay, so this is the second paper that I found, that they also explain molecular hydrogen suppress the activated WNT or the beta-catenin signaling. This is another signaling pathway that very much related to cancers and also degenerative diseases such as OA. And this paper found the hydrogen molecule can reduce the activations of this WNT beta-catenin signaling in human osteoarthritis chondrocytes. And in this study, right, they let the rats, okay, it's also an animal study, they let the rats to drink hydrogen water with 1.66 ppm for 8 weeks. And after 8 weeks, when they compare the control group and the rats with the treatment, with the hydrogen treatments, they found that the oral intake of the hydrogen water tended to ameliorate the cartilage degradation, okay, in the animals. Okay, how they do that? They actually reduce the beta-catenin accumulation, and just simply doing that, they can actually reduce the inflammation and reduce the progression of osteoarthritis. Yeah, there's another next paper. Next slide, please. Sure.
All right, yep, next slide here.
Yeah, so this one is in vitro experiment. So this one not studied in the rats, but they use the cell culture method experiment. So they found that hydrogen can actually reduce ONOO. ONOO is the peroxide nitrate. Peroxide nitrate is a harmful free radicals. So not only OH. OH has been proven by Professor Otta, okay, many years ago. And this is the new findings. They also found hydrogen can actually reduce another type of harmful free radicals, which is known as peroxide nitrate. The symbol is ONOO. Okay, so selective removal of ONOO may represent a powerful method to prevent or can be used as a therapeutic treatment for the joint diseases such as OA. Yeah, so these are the three main articles that I have found that is related to OA. And there are many more other articles that if you're interested, you can just Google search. Okay, there are many more other publications have shown the effects of hydrogen on OA.
Now we'll talk a bit about what Hi-Bliss hydrogen therapy does. Hi-Bliss is the first hydrogen therapy center in Malaysia. We take a holistic approach, which includes spraying molecular hydrogen gas and also using physiotherapy to help people live their best life. We have helped over 3,000 people so far live active and healthier lives. This is how you can expect to see this hydrogen therapy to work. First, we begin with our consultation and assessment. We conduct a microblood analysis to check and examine your blood circulations and body conditions. Then we will do palpation, where we check skin temperature and signs. And we will conduct palpation and check for muscle imbalances, knots, inflammation, and determine sources of pain. Then we will spray molecular hydrogen gas, which will be absorbed into your body cells to neutralize the free radicals. Lastly, we will use manipulation, which reduces inflammation and pain, releasing knots and tension in your muscles, improving blood circulations, reducing stiffness, and so on. Then, lastly, we use stretching exercises to take the holistic approach, stretch and strengthen your muscles for long-term flexibility and mobility. So that's essentially what Hi-Bliss hydrogen therapy is all about. I'd like to take this moment to share one of our testimonials who has osteoarthritis and has benefited significantly from hydrogen therapy.
你未知道啊！如果個腳唔行得點樣？我人好自卑嘅，你叫我攞當吉出門啊！我今年死俾你睇啊！我都唔愛係咪？好奇怪嘅嗰啲唔知咩風嚟嘅喎，我總之用嗰啲風嚟吹，我就好就咁簡單啫啦。上樓梯我又唔使扶，直直上直直落，唔係上1樓啊，直頭上到7、8樓，落到7、8樓，完全都好似年輕人咁樣走得行得。吹咗真係依家有4、5個月啦，完全都係好健康，我真係好多謝佢哋啊！